Recent development of theoretical systems, or TCM. Today we explore the historical evolution and key writings that shaped traditional Chinese medicine from ancient times to the Qing dynasty. TCM encompasses a rich tapestry of theoretical systems that have evolved over centuries. These systems integrate various philosophical, clinical, and empirical insights into health and disease, establishing a holistic approach to wellness that underpins TCM practice today. Authored by Qin Huiran, this significant work built upon the foundations established in Huangdi's internal classic, effectively enriching the theoretical framework of TCM. It represents a pivotal point in the historical development of TCM theories, setting the stage for future advancements in medical understanding and practice. The Treatise on Febrile and Miscellaneous Diseases by Zhang Zhongqing is a landmark text in TCM, marking the first comprehensive clinical manual focused on the practice of syndrome differentiation. This foundational work not only outlined various febrile conditions, but also established treatment protocols tailored to the specific symptoms and patterns observed in patients. Contributions of the Qin dynasty to TCM. In the Qin dynasty, Zhang Zhongqing's influential work, Treatise on Febrile and Miscellaneous Diseases, was revised into two essential texts by Wang Shuhe, Treatise on Febrile Diseases and Synopsis of Prescriptions from the Golden Chamber. This marked a significant development in clinical medicine, emphasizing treatment based on syndrome differentiation. The Qin dynasty introduced new medical concepts that built upon earlier theories, enhancing the understanding of etiology and pathogenesis. This included detailed approaches to syndrome analysis and treatment strategies, which were foundational for later developments in TCM. Treatment of different kinds of diseases. Authored by Chao Yunfeng during the Sui dynasty, this groundbreaking medical text marked the first comprehensive approach to understanding diseases through their etiology, pathogenesis, and syndrome analysis. It laid the foundation for future medical practices in TCM by emphasizing the importance of identifying the underlying causes and mechanisms of diseases. Key developments in TCM during the Song, Qin, Yan dynasties. The earliest pediatric monograph in China, Key to Therapeutics of Children's Diseases, was authored by Tian Yi during the Song dynasty, marking a significant development in the understanding and treatment of children's health issues. Introduction of the three causes theory. Prescriptions assigned to the three categories of pathogenic factors of diseases, written by Chen Wuzi in the Song dynasty, introduced the theory of three causes in etiology, providing a structured understanding of disease origins. During the Qin-Yuan dynasties, well-known physicians from four distinct schools contributed significantly to TCM, each emphasizing different methodologies and theories, leading to a richer and more diversified medical practice. Contributions of the four schools in Qin-Yuan dynasty. Liu Wansu, the School of Cooling. The School of Cooling, founded by Liu Wansu, emphasized using herbal drugs that are cold and cool in nature to counteract diseases arising from excessive fire, a key concept linking emotions and physical health. Zhang Gongzheng's School of Purgation held that diseases were caused by evil factors and promoted treatments to expel these factors, including methods like diaphoresis, emesis, and purgation. Li Kao's School of Strengthening the Spleen and Stomach focused on internal injuries of these organs as primary disease causes, advocating for treatments that build and regulate their function. Zhu Danqi's School of Nourishing Yin emphasized the necessity of nourishing yin while reducing fire, reflecting a balance between these opposing forces in the body for effective disease treatment. Innovations in TCM during the Ming and Qing dynasties. Wu Yuke in the Ming Dynasty introduced the groundbreaking theory of pestilential qi, suggesting that infectious diseases arise from a specific evil qi rather than traditional elements like wind and cold. Ye Tianshi and Hu Zhutong from the Qing Dynasty advanced diagnostic and treatment methods for epidemic febrile diseases, emphasizing syndrome differentiation based on the theory of Wei, Qi, Ying, and Shui. Wang Qingren in the Qing Dynasty focused on anatomical accuracy within medical classics, correcting errors and developing the theory that blood stasis could lead to diseases, along with treatment methods for these conditions. Innovations in diagnosis and treatment by Ye Tianshi and Hu Zhutong. Ye Tianshi and Hu Zhutong were influential physicians in the Qing Dynasty who specialized in epidemic febrile diseases. They developed comprehensive methods for diagnosis and treatment that focus on differentiating syndromes, considering various factors such as Wei, or defense, Qi, vital energy, Ying, nutrient, and Shui, blood. This systematic approach laid the groundwork for modern TCM practices related to febrile diseases. Integration of the theory of Santiao. Their work integrated the theory of Santiao, triple burner, which plays a critical role in understanding the relationship between different bodily functions and their impact on health. This connection helped to enhance the treatment strategies used for epidemic diseases by focusing on balance and harmony within the body. The evolution of TCM theoretical systems. TCM has undergone significant evolution from its early foundations in ancient texts to sophisticated theories developed through various dynasties. These advancements have shaped contemporary practices, bridging ancient wisdom with modern healthcare approaches.
Let's discuss diagnosis by observation in Chinese medicine, exploring the significance of visual diagnostics and its historical context in Chinese medicine. Diagnosis by observation is a foundational technique in TCM, recognized for its historical significance as the highest form of diagnostic skill. It allows practitioners to assess a patient's overall health and internal conditions through careful visual examination, providing insights into their constitution, body type, and even emotional state. Historical significance of in ancient Chinese medicine, diagnosis by observation was revered as the highest form of diagnostic art. Doctors trained in this technique could assess a patient's health solely through visual cues, demonstrating exceptional skill and knowledge. A practitioner who excelled in diagnosis by observation was considered a superior doctor. This skill set distinguished them within the medical community as they could swiftly and accurately assess patients without invasive methods. Diagnosis by observation was the first technique employed when a patient arrived for consultation. It established a foundational understanding of the patient's condition, allowing for immediate insights into their health status. In TCM, the observation of patients is grounded in the concept that internal organ dysfunctions are reflected internally as images, or qiang. These images encompass various manifestations such as pulse patterns, skin complexion, tongue appearance, and overall demeanor, providing vital insights into the patient's health status and internal imbalances. The principal, internal, and external correspondence. In TCM, the internal organs are not merely functional units, they represent deeper connections to the external world. This principle of correspondence suggests that each organ has distinct external manifestations that reflect its internal health. Each organ state can be assessed through various images such as pulse, complexion, patterns on the tongue, and general appearance. These images provide vital clues about the internal disharmony and guide diagnosis. Key concepts from simple questions and spiritual axis. Images of 5 yin organs, correspondence of sounds, and pulse and color integration. Integrating whole picture and details in observation. When practicing diagnosis by observation, it's essential to balance the holistic view with attention to specific details. This ensures accurate understanding and interpretation of the patient's condition without falling into the traps of overlooking significant details or misjudging the overall picture. Mapping the body, correspondences between organs and body parts. The 5 senses are integral to diagnosis, with each sense corresponding to specific internal organs, enhancing the diagnostic process through sensory observation. Facial regions are mapped to specific internal organs, offering visual clues about the health and balance of these organs. Different tissues in the body correspond to internal organs, providing insights into the overall health and state of the body system. The 5 senses and their correspondence to internal organs. Understanding how senses are linked to internal organ health and function. Sight. Eyes correspond to the liver, influencing vision and emotional health. Hearing. Ears correspond to the kidneys, playing a role in hearing and balance. Smell. Nose corresponds to the lungs, connected to the sense of smell and respiratory health. Taste. Tongue corresponds to the heart, reflecting emotional state and circulation. For touch, skin corresponds to the spleen, affecting sensation and overall skin health. Facial areas and their correspondence to organs. For forehead, it represents heart and health. For cheeks, it indicates lung condition. And for chin, it reflects kidney status. Tissues and internal organ relationships. In TCM, different tissues of the body are intimately connected to specific internal organs, reflecting the principle of correspondence. Muscles are associated with spleen, which plays a crucial role in the production of qi and blood. The health of the muscles can indicate the spleen's strength or weakness. Skin is linked to the lungs, which govern the body's weight qi. Healthy skin often reflects the lungs' ability to regulate and protect the body from external pathogens. Connective tissues correspond to the liver, emphasizing its role in ensuring smooth qi flow and emotional well-being. See transformation sites and their relationship to yin organs. See transportation sites are essential pathways through which qi flows to nourish and support the functions of the yin organs. These sites ensure that each organ receives the necessary energy to maintain health and balance within the body. Each yin organ corresponds to specific qi transportation sites, which are integral to their proper function. Understanding these relationships help diagnose and treat conditions based on chi flow and organ health. Manifestations of the five yin organs. Emotional states are closely linked to the health of the five organs, reflecting internal disharmonies. Liver, anger, frustration, and irritability indicates imbalances in liver chi. For the heart, excessive joy or anxiety may manifest as palpitations or restlessness, reflecting heart disharmony. The spleen, chronic worry and overthinking can weaken the spleen, leading to digestive issues and fatigue. Lungs, grief and sadness can hinder lung function, resulting in respiratory issues or emotional blockage. For kidneys, fear and insecurity can impact kidney health, leading to issues like low back pain or reproductive concerns. The 12 cutaneous regions, connections to internal health. The 12 cutaneous regions serve as a crucial diagnostic tool in TCM, linking specific areas of the skin to corresponding internal organs. By examining these regions, practitioners can gain insight into the health and balance of the internal systems. Diagnosis by observation is crucial in TCM, requiring practitioners to balance the integration of overall patient presentation with attention to specific details. Mastery in this diagnostic technique not only enhances understanding of a patient's health, but also supports accurate diagnosis by recognizing the images that reflect internal disharmonies. Thank you for your attention.
Understanding Heart 9, Shao Chung, Lesser Rushing. We explore the multifaceted functions and therapeutic applications of Heart 9. Heart 9 is located on the radial side of the base of the nail of the fifth digit, specifically 0.1 tune lateral to the nail's corner. This vital acupuncture point acts as the wood point, tonification point, exit point, and Tingwell point on the heart meridian, playing a crucial role in regulating heart chi, nurturing growth, and facilitating emotional balance. Functions of Heart 9. Heart 9 regulates the flow of chi into the heart, ensuring that energy levels are balanced and that the heart functions optimally. As a Tingwell point, Heart 9 has the ability to restore consciousness, particularly in cases of collapse or severe distress, such as wind stroke, making it a critical point for emergency treatment. This point effectively clears heat from the upper regions of the heart channel, including the throat and mouth, alleviating symptoms such as dryness and pain. Heart 9 invigorates the blood, facilitating better communication within the heart and enhancing emotional and physical vitality, which is vital for overall well-being. Heart 9 serves as both a tonification point and a Tingwell point, playing a critical role in the heart meridian. As a tonification point, it connects the nurturing wood element to its child element, fire, facilitating growth and providing calming energy to the spirit. In its capacity as a Tingwell point, it promotes a robust flow of chi along the meridian, invigorating the body's energy and restoring balance. To role in the Shang cycle. Understanding the connection between the wood and fire elements in the heart meridian enhances our comprehension of its therapeutic applications. Heart 9 serves as a crucial link in the Shan cycle, facilitating the flow of energy from wood to fire. As a tonification point, Heart 9 invigorates the blood, facilitating growth and providing calming energy to the spirit. In its capacity as a Tingwell point, it promotes a robust flow of chi along the meridian, invigorating the body's energy and restoring balance. To role in the Shang cycle. Understanding the connection between the wood and fire elements in the heart meridian enhances our comprehension of its therapeutic applications. Heart 9 serves as a crucial link in the Shan cycle, facilitating the flow of energy from wood to fire. It nurtures growth and supports emotional stability. This connection calms the spirit, especially in cases of qi deficiency. The dynamism of wood clears pathways for enhanced intelligence and reflection. Heart 9 invigorates the blood, which is essential for effective heart communication. Heart 9 is used for a variety of conditions, reflecting its multifaceted therapeutic benefits. Fever, elevated body temperature indicating possible infection or illness. Delirium, acute confusion or altered mental state, often requiring immediate attention. Sudden, uncontrolled electrical disturbances in the brain, seizures, necessitating urgent care. Palpitations, irregular or racing heartbeats, often linked to anxiety or cardiovascular issues. Emotional exhaustion, a state of feeling emotionally drained, often related to chronic stress. Depression, a mood disorder characterized by persistent sadness and loss of interest. Heart 9 regulates heart-related conditions, alleviates emotional disturbances, clears heat-related symptoms, supports consciousness restoration, and treats chest and costal pain. Clinical applications and combinations, utilizing Heart 9 in conjunction with other points for effective treatment. For hyperarousal management, we combine Heart 9 with PC7 and PC6. For coma or stroke resuscitation, Heart 9 plus PC9 plus GB26 for recovery from loss of consciousness or stroke. Hyperthermia treatment, we combine Heart 9 with GB20, Liver 2, and Liver 3 for heat regulation in the body. Heart 9 serves as a crucial acupuncture point within the heart meridian, embodying the tonification point and Tingwell point characteristics. Its unique properties allow it to regulate heart qi, clear heat, invigorate blood, and restore consciousness, making it essential for addressing a range of conditions such as palpitations, emotional exhaustion, and loss of consciousness. By nurturing the connection between wood and fire within the Shang cycle, Heart 9 promotes overall well-being and mental clarity. The Song and Qin Dynasties, a period of medical evolution. Today we explore the integration of Confucian philosophy and medical advances in ancient China. The Song Dynasty marked a significant era in Chinese history, characterized by the integration of Confucian philosophy into governance, culture, and daily life. This period laid the foundation for a holistic understanding of society, including the advancement of medical practices influenced by Confucian values and eclectic philosophies, which persisted into the Jin dynasty. Confucianism solidified its role as the backbone of governance during the Song dynasty, influencing laws, policies, and civil service examinations that prioritized moral integrity and scholarly achievement. The focus on moral integrity was paramount, with Confucian ideals shaping the conduct expected of individuals in both public and private life, fostering a society rooted in ethical behavior and virtuous leadership. Education became a vital aspect of societal development, with Confucian teachings embedded in curricula across schools, reinforcing values such as respect for authority, filial piety, and the importance of learning. The Song dynasty was pivotal in consolidating Confucian philosophy, integrating it deeply into the fabric of Chinese society, including its medicinal practices. Neo-Confucianists played a crucial role in unifying various medical theories, bridging Confucian thought with practices from Taoism and Buddhism, leading to a more holistic understanding of health. The influence of Confucian ethics shaped medical practices, emphasizing moral integrity, proper conduct, and the holistic treatment of patients, which became essential in diagnosing and treating illnesses. The Song dynasty saw the unification of various philosophical schools, particularly through the efforts of Neo-Confucianists who synthesized Confucianism with elements of Taoism, Buddhism, and naturalism. This integration allowed for a more comprehensive understanding of both philosophy and medicine. Naturalism influenced medical practices by emphasizing the connection between nature and the human body, while legalism provided a structured approach to governance that paralleled the organization of medical theories. Mohism introduced concepts of universal love and utilitarianism that affected social perspectives on health and wellness. The eclectic approach to medicine during the Song and Qin dynasties promoted a holistic understanding of health, considering the interplay of body, mind, and environment. This perspective encouraged the development of diverse diagnostic methods and treatment strategies, integrating both physical and psychological aspects of health. During the Song dynasty, tongue diagnosis became a pivotal aspect of TCM, capturing the interests of many physicians. This practice evolved into a specialized study where medical writers meticulously documented their diagnostic observations and correlations with various health conditions. Diagnostic observations in Chinese medicine. Key symptoms and their significance in TCM diagnostics. Heat pattern indicators are restlessness, oppression in the chest, dry tongue, thirst, deep, slippery pulse. Disease of the lesser yin, kidney, indicators. Dry mouth, dry tongue, deep, slow pulse. Dry tongue with dry throat indicates irregular diet and overwork. Dry tongue with chest and hypochondriac pain is caused by stagnation of liver qi from emotional problems. Dry tongue with bitter taste are symptomatic of heart fire. Dry or wet tongue correlates with excess, deficiency, or yang-yin conditions. Li Tongyuan's work, Discussion of the Spleen and Stomach, positioned the spleen and stomach as central to bodily health and treatment approaches. His emphasis on tongue diagnosis revealed diagnostic links between symptoms and underlying conditions, advancing the understanding of Chinese medicine during the Qin dynasty. Li Tongyuan emphasized that the spleen and stomach are fundamental to overall health, serving as the primary organs for digestion and nutrient absorption. His insights laid the groundwork for the treatment approaches that focus on these organs, highlighting their significance in maintaining bodily harmony. Li Tongyuan emphasized that the spleen and stomach are essential organs in the body, and treatment should primarily target these organs for effective health management. A dry tongue can indicate various health issues, often linked to irregular diet and overwork, highlighting the need for dietary adjustments in treatment. Emotional problems can lead to liver qi stagnation, which is often reflected in tongue diagnosis, further underscoring the connection between emotional health and physical symptoms. A dry tongue accompanied by a dry throat indicates irregular diet and excessive work, pointing to the impact of lifestyle choices on health. When a dry tongue is observed alongside chest pain, it suggests liver qi stagnation, often linked to emotional distress or stress-related issues. A dry tongue accompanied by a bitter taste in the mouth is symptomatic of heart fire, indicating potential issues related to the heart's energy and functions. Li Tongyuan established a foundational correlation between tongue conditions and the physiological states of excess or deficiency in yin or yang. He emphasized that the nature of the tongue's condition, whether dry or wet, can provide insights into a patient's overall health and balance. During the Song and Qin dynasties, the integration of Confucian philosophy with medical practices led to significant advances in Chinese medicine. The emergence of diagnostic methods, particularly tongue diagnosis, showcased a holistic approach to health and the importance of contextual symptom evaluation, setting a foundation for future medical theories. Understanding palpation in diagnosis. Today, we explore the role of touch in medical assessment and treatment. Palpation is a crucial diagnostic pillar that gathers valuable information through the sense of touch. It encompasses various techniques, including assessing the pulse, examining channels, acupuncture points, skin texture, and other bodily areas, thus enabling a comprehensive understanding of the patient's condition. Palpation plays a crucial role in the diagnostic process, offering insights that cannot be obtained through verbal communication or visual observation alone. It serves as one of the four essential pillars of diagnosis, ensuring stability and reliability in clinical assessments. Challenges in learning palpation. Translating tactile sensations into intellectual knowledge can be challenging, as practitioners may struggle to articulate what they feel during palpation. This difficulty can hinder the learning process and affect diagnostic accuracy. The subjective nature of palpation can lead to uncertainty in assessments. Practitioners may doubt their findings, especially when they feel sensations that do not match textbook descriptions, leading to potential misdiagnosis. Comparing tactile sensations with textbook descriptions can be difficult, as the nuances of what is felt may not align perfectly with standardized definitions. This discrepancy can make learning palpation feel like an ambiguous task. Palpation is a cornerstone of diagnosis, providing critical insights through tactile examination. It is particularly vital in pulse diagnosis, which aids in distinguishing the eight principles and contributes significantly to Zhang-Fu diagnosis and assessments of qi and blood. Pulse diagnosis overview. Pulse diagnosis is an essential technique that provides insight into a person's energetic state. By palpating the pulse, practitioners can assess the quality and rhythm which correspond to the health of the individual's qi. Changes in the pulse can indicate variations in the body's qi and vital substances. For example, strong or weak pulses may reflect fluctuations in energy, blood flow, or overall vitality. Pulse diagnosis is capable of identifying CHI pathogenic factors early in the diagnostic process. This allows practitioners to address underlying issues before physical symptoms become apparent, enhancing preventative care. Advantages of palpation. Essential for muscular diagnosis. Objective assessment tool, immediate feedback on conditions, guides treatment adjustments, and reveals hidden conditions early. Palpation provides immediate feedback on the effectiveness of treatments by assessing qualitative changes in the pulse, abdomen, and skin. This real-time assessment enables practitioners to make necessary adjustments for optimal patient care. Practical training in palpation, a structured approach to mastering palpation techniques and skills through continuous practice. Engage in practical sessions with an experienced teacher to gain real-time feedback and guidance. Continuously practice and refine diagnostic methods to enhance tactile sensitivity and accuracy. Utilize textbooks as a systematic learning tool to compare experiences and deepen understanding of palpation. Becoming proficient in pulse diagnosis. Regular practice allows for the refinement of tactile skills, enhancing the ability to identify specific pulse qualities accurately. Consistent engagement with patients fosters muscle memory and boosts confidence. Utilize resources such as textbooks and instructional videos to solidify understanding of pulse characteristics. This comparative analysis strengthens the link between theoretical knowledge and clinical application. Engage in supervised practice where immediate feedback can be provided. Learning from experienced practitioners enables quicker adaptation and correction of techniques, leading to improved accuracy. Relative strengths of palpation, crucial for musculoskeletal diagnosis, objective assessment method, direct sensory feedback, immediate insight into conditions, enhances overall diagnostic process. Relative weaknesses of palpation. Subjective nature creates doubt. Challenge in sensation accuracy, learning curve for practitioners, requires consistent practice and possible misinterpretation of findings. Diagnostic tips for effective palpation. Always palpate the muscles and joints when a patient presents with physical pain or impaired movement to identify the source of discomfort and guide treatment. Areas of the body that feel hot during palpation suggest the presence of heat, indicating a potential imbalance that requires further investigation. Investigating the skin's temperature, moisture, elasticity, and muscle tone while palpating provides critical insights into the patient's health status and guides treatment decisions. Introduction to scalp acupuncture. Today we explore the therapeutic benefits and techniques of scalp acupuncture in TCM. Scalp acupuncture is a therapeutic approach that focuses on needling specific areas on the scalp to treat and prevent various diseases. This innovative therapy integrates TCM principles, acupuncture methods, and contemporary understanding of the brain's anatomy and functions, making it effective for a wide range of clinical applications. It is a therapeutic approach that employs targeted needling at specific areas on the scalp to stimulate healing and alleviate symptoms. It is particularly effective for addressing disorders of the central nervous system, as well as various conditions in internal medicine, gynecology, and pediatrics. Therapeutic principles. Scalp acupuncture therapy is rooted in the principles of TCM, which emphasizes the balance of qi and the interconnectedness of body systems. It employs acupuncture techniques that involve inserting thin needles into specific points on the scalp to stimulate healing and restore balance. The therapy is informed by clinical experience, which enhances its efficacy through the observation and treatment of various conditions over time. Holographic theory suggests that the scalp reflects the entire body, allowing for the treatment of various conditions through targeted stimulation of specific areas. Modern knowledge of the cerebral cortex provides insights into how specific scalp areas correspond to different bodily functions, enhancing treatment precision. Clinical applications of scalp acupuncture treats central nervous system disorders, addresses sequelae of cerebral disease, aids in maldevelopment of nervous system, helps with sequelae of brain damage. Conditions treated by scalp acupuncture. Scalp acupuncture is a versatile therapy with broad applications across multiple medical disciplines. 100 plus different diseases are treated, effective for paralysis due to stroke, applicable in internal medicine, gynecology, and pediatrics. Theoretical foundations. Zhang-Fu theory explains the relationship between the internal organs, the Zhang and Fu, and their physiological and pathological functions in the body. This theory is fundamental in understanding how different organs interact and influence health. Meridians are pathways through which qi flows throughout the body. Understanding these channels is essential for effective acupuncture treatment as they connect various body parts that influence overall health. The connection between blood circulation and qi is vital in TCM. Adequate blood flow is essential for nourishing organs and tissues, while stagnant blood can lead to health issues. Physiologic functions refer to the normal processes that occur within the body. Scalp acupuncture aims to enhance these functions by stimulating appropriate scalp areas linked to various organs. Pathologic changes indicate alterations in body systems that lead to disease. Scalp acupuncture is utilized to address these changes by targeting areas on the scalp corresponding to affected organs. The scalp serves as a crucial junction for the body's Zanfu organs, meridians, qi, and blood. This interconnectedness plays a vital role in maintaining physiological balance and responding to pathological changes within the body. Scalp acupuncture represents a significant advancement in therapeutic techniques, integrating traditional practices with modern medical insights. Continued research and clinical trials are essential to fully harness its potential in treating diverse medical conditions and enhancing patient outcomes. Introduction to ear acupuncture. A comprehensive overview of ear acupuncture techniques, history, and its integration in modern medicine. Ear acupuncture therapy stimulates specific points on the auricle to treat and prevent various diseases. This method is known for its simplicity, wide range of applications, minimal side effects, cost effectiveness, and favorable outcomes, making it a valuable practice in both traditional and modern medicine. Ear acupuncture therapy is a method of treating and preventing disease by stimulating specific points on the auricle using needles or other devices. This practice has a long-standing history in Chinese medicine, with documented references dating back over 2,100 years, highlighting the connections between ear meridians and various parts of the body, such as the upper arms, eyes, cheeks, and throat. Historical background. A timeline illustrating the evolution of ear acupuncture across different cultures and periods. Over 2,100 years ago, the text Boshu Qingmai records the relationship between ear meridians and various body parts, laying the foundation for ear acupuncture in Chinese medicine. Tang Dynasty. Moxibustion on the ear was documented as a treatment for mouth and eye deviations, showcasing the therapeutic applications of ear acupuncture. 1600s to 1800s, Chinese medicine, including ear acupuncture, was introduced to Europe, with practitioners using acupuncture and moxibustion to treat conditions like sciatic nerve pain. 1946, Dr. Edith L. Potter reports the relationship between ear shape and kidney problems, contributing to the understanding of ear acupuncture's diagnostic capabilities. 1950s, modern ear acupuncture was systematized by French neurologist Paul Noget, who developed the embryological ear map and advanced the theoretical foundations of ear therapy. Ear acupuncture operates on the principle that the ear serves as a microcosm of the entire body. Its structure reflects various parts of the body, allowing for targeted treatment through stimulation of specific points. The concept of bioholography suggests that the ear contains a complete representation of the body's physiological and pathological states. This implies that any imbalance or disorder within the body can be reflected in the ear's condition. The ear's anatomy is closely linked to the Zanfu organs and the four extremities, allowing practitioners to identify and treat various health issues through auricular acupuncture. Each region of the ear corresponds to specific organs and body parts, enhancing diagnostic and therapeutic capabilities. Physiological connections. The Neijing, an ancient Chinese medical text, emphasizes the intricate connections between the ear and the meridian system, highlighting its importance in traditional Chinese medicine practices. The 12 regular meridians display a cyclical flow, with 6 yang meridians entering through the ear or distributing to the surrounding areas, while 6 yin meridians connect indirectly, reflecting the ear's role in overall bodily health. Clinical observations have noted that some patients experience unique sensations such as electric or warm watery feelings, which travel from the ear along the meridians, indicating active energy flow and physiological responses. Zanfu organ relationships. The ear is intricately linked with the 5 Zan and 6 Fu organs, influencing and being influenced by their physiological states. This relationship is documented in traditional texts, highlighting the ear's role in the overall health of the body. The kidney, in particular, has a strong connection to the ear. When kidney health is optimal, it positively affects hearing capability. This relationship emphasizes the importance of kidney health in maintaining auditory functions. Disorders of internal organs can manifest on the ear, indicating that the ear serves as a reflection of the body's internal health. This principle is fundamental in acupuncture, where treating specific ear points can influence health outcomes. Clinical applications and observations. It treats headaches effectively, addresses menstrual discomfort, used for anxiety management, improves sleep quality, supports weight management. Modern development and standardization, the evolution and formalization of ear acupuncture practices and terminology over time. 1946, Dr. Edith L. Potter reported a correlation between the shape of the ear and kidney-related genetic problems, highlighting the importance of ear anatomy in understanding organ health. 1987, the Chinese Department of Health recognized a standardized auricular nomenclature consisting of 90 ear acupuncture points, facilitating clearer communication and practice in acupuncture. WHO involvement and nomenclature. The World Health Organization's role in establishing standards and recognition for ear acupuncture practices. WHO recognized auricular acupuncture as a scientifically documented practice, affirming its relevance in modern healthcare. The third WHO working group met in 1987, focusing on the standardization of auricular acupuncture points to enhance global practice. A comprehensive plan was initiated for the future development of a standard reference chart to guide practitioners in auricular acupuncture. Comparison of Chinese and European systems. Chinese ear acupuncture is deeply rooted in traditional Chinese medicine, emphasizing historical practices and the holistic connection between the ear and the body's meridians, Zangfu organs, and qi flow. It often utilizes well-established points derived from the ancient texts and clinical experiences over centuries. European ear acupuncture, developed by Paul Nozier, integrates modern medical understanding, focusing on the anatomy and physiology of the ear. It incorporates the somatotropic mapping of the ear to treat various conditions, aligning with contemporary medical theories such as neurohumoralism and bioholographic systems. Ear acupuncture represents a synthesis of ancient wisdom and modern science, integrating traditional Chinese medical practices with contemporary anatomical and physiological insights. Its established efficacy and ongoing research indicate a promising future for therapeutic applications across various medical fields.
Let's now go to gua sha for back waist pain, exploring the efficacy of gua sha therapy against back waist pain, focusing on techniques and benefits. Gua sha is a TCM therapy focused on scraping the skin to enhance blood circulation and provide pain relief. This ancient practice is especially beneficial for addressing back waist pain, which is common among middle-aged and older individuals due to various lifestyle and health factors. Back waist pain frequently affects many people, particularly those who are middle-aged or older. Contributing factors include irregular lifestyles, insufficient rest and exercise, and exposure to cold, leading to imbalances in vital energy and blood circulation. Causes of back waist pain. Irregular lifestyle. Many individuals, particularly middle-aged and older adults, often face back waist pain due to an irregular lifestyle characterized by inconsistent routines and unhealthy habits. Inadequate rest and physical exercise can weaken the back muscles and contribute to pain. Regular movement and sufficient sleep are vital for maintaining back health. Cold weather can exacerbate back pain. The intrusion of cold can lead to stasis of vital energy in blood, resulting in discomfort and pain in the waist area. A deficiency in yang energy within the kidneys can contribute to back pain. This energy insufficiency allows for the invasion of wind cold and impairs normal circulation. Wind cold and stasis of vital energy in blood can lead to significant discomfort in the waist area, necessitating therapeutic interventions like gua sha for relief. Impact of age and osteoporosis. The accelerated loss of calcium in middle-aged and older individuals often results in osteoporosis, contributing significantly to back waist pain. While gua sha scraping therapy can alleviate symptoms temporarily by improving circulation and invigorating blood flow, it is not a definitive treatment. Patients are advised to seek timely medical evaluations for comprehensive management of their condition. The gua sha technique overview. Gua sha is a TCM therapy that utilizes a smooth-edged tool to scrape the skin, promoting better circulation and relieving pain. This technique targets not only the symptoms of back-based pain, but also addresses underlying factors such as stagnant energy and blood flow, making it an effective holistic solution for many individuals, especially those suffering from age-related conditions. Therapy to increase curative effect. It enhances spinal flexibility, relaxes muscle tension, promotes blood circulation, reduces back pain, and encourages restful sleep. Recommended procedures for gua sha. First, scraping waist and back. Use the surface scraping technique to treat painful areas on the waist and back by scraping from top to bottom until the characteristic redness known as sha appears. This helps to enhance circulation and relieve pain. Second, scraping wrist and foot reflection area. Gently scrape the reflection area of the waist on the third metacarpal bone and the reflection area of the spine located on the inside of the foot. This technique targets reflex points to relieve tension and promote overall well-being. Third, scraping key acupoints GV14, GV3, and Qiaji. Apply the surface scraping technique from the Jiaqiu point to Yaoyangquan on both sides of the back. Follow this by using dual angle scraping to treat the Qiaqi to enhance the therapeutic effect. Scraping key acupoints GV4 and bladder 23. Utilize the surface scraping technique on key acupoints, the Mingmen and the Shenchu on the back, scraping from top to bottom to help invigorate blood and alleviate pain in those areas. First, scraping the waist and back. The surface scraping technique is designed to alleviate pain in the waist and back by enhancing blood flow and releasing tension. This method should be applied gently, scraping from the upper to lower parts of the affected area until the characteristic red marks, known as sha, appear on the skin, indicating improved circulation and energy flow. wrist and foot reflection area. Utilizing the reflection areas on the body can enhance the effectiveness of gua sha therapy for back waist pain. Gently scraping on these specific points helps in pain relief and promotes overall well-being. Key acupoints GB14, GB3, and Chiachi. Effective gua sha techniques for back pain involve targeting specific points, scraping from Tatshu to Yang Kwan, stimulates energy flow and alleviates tension along the spine, followed by scraping the Chiachi to enhance overall relief. The key acupoints GB4 and bladder 23. Mingmen and Shanshu are crucial acupoints in gua sha therapy for alleviating back-based pain. Employing a surface gradient technique on these points help invigorate blood circulation and promote healing in the affected areas. Conclusion and recommendations. Gua sha is an effective temporary solution for alleviating back-based pain, particularly in middle-aged and older adults experiencing discomfort due to lifestyle factors and energy imbalances. However, it is crucial for individuals to consult medical professionals for comprehensive evaluations and treatments for underlying issues like osteoporosis.